Good afternoon, everybody. Welcome to a rare Money in the Afternoon recording. Money in the Afternoon. We've had a very busy day and a lot of stuff going on today. So we weren't able to do our Money in the Morning this morning. So we got to do Money in the Afternoon. But lucky you. You get to be here for this thing. All right. If you've got questions about what we're talking about, we're going to do things a little different where you will... We'll have a discussion in the comment section. So feel free, if you're watching this live, to jump in with comments or questions. All right. And we will take both of those during the recording. Let's just check our sound here. Check. Need that a little louder. Good deal. Okay. Hey, Daryl. All right. So once again, if you have anything that you want to ask about on either of these topics, feel free to bring it on. We're going to change this up just a little bit, make it slightly more interactive than usual. Usually it's you just watching me do this thing, and had a discussion about this at lunch today. So we're going to mix it up. Okay, here we go, guys. This is for Friday. Live from my mom's half-finished basement, it's Money in the Morning. Hey, kids, I'm Joe Saul-C. Hi, Average Joe Money on Twitter. And Stackers, do we have a show for you? Healthcare costs. Good news here, rising at a lower rate than usual. Let's talk about what's up with healthcare costs and a lot more retirees, people retirement age. Not a retiree, still working. What's that all about? What does that have to do with your money? We're going to share those and tie to a big idea on today's podcast. Stacking Benjamins presented by Tiller. You know, Tiller spreadsheets are for the inner nerd in you. If you're somebody that loves your spreadsheet, but you want them to be easier, where all the data comes directly from your investment accounts and from your budget accounts. Well, guess what? You can do that and manipulate it however you want. stackingbenjamins.com/Tiller tells them that we sent you. And by the way, if you buy Tiller, they send us a little thank you for sending you their way. Right now, we're sending you the way of headlines. So let's get this party started, shall we?
Hello, darlings. And now it's time for your favorite part of the show, our Stacking Benjamins headlines.
Oh, yeah, healthcare costs, kids, not going up as quickly as they have in the past. It's written by Guy Bolton in the USA Today. You'll be shocked at the price of healthcare for a family of four is the headline. It says healthcare costs have been increasing at the lowest rate in the past 2 decades. Isn't that great? The result? The total cost for a typical family of four insured by the insured by the most common health plan offered by employers will average $28,166 this year, according to the annual Milliman Medical Index. Let's do that again. The total cost for a typical family of four insured by the most common health plan offered by employers will average $28,166 this year. $28,000. How about that? Didn't expect it to be that high, did you? The estimate includes the average cost of health insurance paid by employers and employees, as well as deductibles and out-of-pocket expenses. Despite the significant expenses for many households and employers, the slower rate of growth is good news, said Scott Welts, a principal and consulting actuary in the Brookfield office of Milliman. Quote, but every month, a family of four's healthcare costs are going up $100 a month, Welch said. The costs have been going up by that amount on average for more than a decade. The Milliman Medical Index topped $20,000 in 2010, 2 years ago it topped $25,000. $28,000. Let's talk about healthcare, because this is a big part of your financial plan. Listen, when it's $28,000 a year, whether it's your money, your employer's money, whatever, $28,000 a year for a family of four, that's a ton of money, isn't it? And that means we've got to make a smart decision around our healthcare. And one thing that a lot of people haven't looked at yet is this little guy called an HSA. And in the past, I've said that HSAs are great if you're super healthy. You know, it's funny. I got a lot of pushback from people that are in the healthcare business saying, dude, you got to look more closely at HSAs, because HSAs might still be the best choice if you're not that healthy. So here's, I think, is the bigger point, and we'll keep the point very, very, very takeaway. Have you considered an HSA? That's a health savings account. Here's, in brief, what a health savings account is. So there's an option in your health insurance through work, possibly, which is a high deductible insurance plan. And that high deductible insurance plan means you're going to have a lot of money out of pocket when you go to the doctor. Now, the good news is that sometimes, you know, depending on what the doctor's visit is, they'll cap those at a certain number that you're going to pay out of pocket before they start paying. But it's going to be higher than just a normal health plan is. So if you do that, if you actually do that type of plan, it's coupled with a savings account that you get to put money in, like a 401k. You get to put money in tax free. Well, let's put it this way. It goes in pre-tax. And then if you use that money to pay those deductibles, you get to take it out tax free. Ends up being tax free in, tax free out. So it does a couple things: shelters your income for your health insurance coverage, puts you then in a lower tax bracket or further down the tax road. So you're paying less tax overall, and it ends up insuring your family. And for a lot of people, if you can stuff money in there, that's fantastic. And a great thing that you can do, by the way, if you keep the receipts and still pay out of pocket, now you can have that money in your HSA. You're allowed to invest that money. And if it invests over a number of years, now you can have the interest on your money paying your medical bills. HSAs can be a great thing. So takeaway, have you checked out an HSA? Let's say hello to our friends watching in Facebook land. We're doing this at a weird time today. We normally do this earlier in the day, but it's been super busy in the basement. Going to say hello to Daryl, who says he still managed to hit his high deductible by mid-year. Congratulations, Daryl. I don't think Daryl's high-fiving himself, right? that he did that. That ends up being a lot of money out of your pocket with an HSA, which is why I used to say that an HSA was great if you're healthy. However, for a lot of people, there's a bunch of other things. There's a bunch of other things at play, and I would just go explore whether an HSA is right for you. So good stuff. And Daryl also says, unfortunately, I can't fund my HSA and pay my medical bills, so my money comes out of the HSA as fast as I put it in. The good news for you, Daryl, though, is it obviously is still pre-tax, right? It still is money that ends up being tax-free, saving you whatever federal, state, local tax that you would have paid. Good stuff there. And our friend Sandy from Yes, I Am Cheap is here. She says, a little late, dude. It is a little late today. We're actually going to pull back the curtain for people listening. It's money in the afternoon today. That's how busy we were in the basement today. And it hasn't gotten any less busy, Sandy. We are cranking here. Rise and grind, Sandy. Rise and grind. That's what we did all morning long. And now the grind's continuing into the mid-afternoon here at Money in the Morning. Chloe's here with us. Hey, Chloe, haven't seen Chloe in a while. Chloe says, I just started an HSA, but unfortunately it's the most expensive plan at my employer. The highest premium. Really? See, it's surprising because usually people choose an HSA because of the fact that the premium is the lowest. It seems really strange that your premium is the highest. The attractiveness of an HSA, especially if you're somebody that has been healthy for a number of years, is that an HSA allows you to build that money if you don't use it right away. It is, and Sandy, who's worked in HR, also says usually the HSA is the cheapest. I can't believe that. Chloe's plan a little different. I might talk to your HR about why that is. It'd be interesting to see why your HSA is the most expensive plan, unless the other plan is having, a couple guys go out back with a saw and take care of your problem. If you've got some in-house medical people, just absolutely ugly there. Let's move on to our second headline today, which is also another one that I found very interesting. That's why we put it on the show. This comes to us from MSN Money. So why are baby boomers still working? And by the way, our friend Doug in our close Facebook group, The Basement, if you head to stackingbenjamins.com/basement, that'll take you right to our Facebook group where we have a ton of fun chats. And Doug wanted us to talk about this. So listen to this. It's written by Ann Brenoff. She says, I'm a 68-year-old baby boomer who still works full time. I'm precisely who younger people point to when they hear the reports that more of them can't find jobs and more of us still have hours. Even as their population numbers have swelled from 2007 to 2015, the number of 22 to 34-year-olds in the workplace has remained the same, while the number of retirement age workers has grown by 9%, according to the Bureau of Labor Statistics. So why don't I just retire, make room for someone younger to have a turn at the trough? Every boomer is a different story, but as a collective group, our defense has been a heartfelt, we need the money. As a demographic, we got hit hard in the Great Recession, lost our jobs, our homes, and our retirement savings. And so, yes, we're still working to replace what we lost more than a decade ago. We're also caregivers to elderly parents. Our adult children still live with us. Our names are co-signed on college loans, second mortgages. And so we have expenses, many incurred in the pursuit of helping others. And last, we exist with a constant reminder we could do very well living into the triple digits, whether we want to or not, thanks to modern science and right to die laws with more holes than Swiss cheese. Too bad neither Social Security nor Medicare is enjoying the robust health or predictions of longevity that boomers appear to be having. So yeah, we need the money, except maybe that's not all of it. People need more than financial security to make the leap to retirement, says Boston College Center for Retirement Research. Work gives us intangible benefits, things like a sense of worth, the knowledge of making a contribution, and a chance to be part of something. How do you replace that? And the piece goes on, and we'll link to this at Average Joe Money on Twitter, my Twitter feed. Pretty interesting stuff there, isn't it? People working longer, millennials saying, hey, what's the deal? I can't get a job, when the baby boomer still has the job. So you think about this from the baby boomers' perspective. They're the sandwich generation. They've got elders older than them still living, taking care of those people. They also weren't able to save enough money. We coming up on the Stacking Benjamin show, we have a gentleman from Morningstar, behavioral scientist from Morningstar, coming on, Stephen Wendell, who talks about behavior-wise, like the fact that we're living so long and we haven't saved hardly any money. And so because we haven't saved hardly any money, we have to work longer and longer and longer. And that's clogging it up for other people. I think that the big takeaway though for us today is this: things are definitely changing. And if you're a millennial, sure, you're going to have to fight for your job, which means that you have to be passionate about that area. You can't just show up, right? You can't show up and expect somebody to pay you for something that you kind of half love. And by the way, if you're somebody in retirement who doesn't want to be pushed out, it's still the same. You can't show up just halfway every day. I think that for older people, especially, transitioning to jobs you love is important. But even for younger workers, working in an area that you have enough passion that you can withstand the competition that's increasing because there's more older people in the job market, it's going to be more important than ever. So don't get me wrong. I don't think that passion is the number one thing out there. I think paying the bills is. But I think if you want to keep your job, I think that having some passion around that job and understanding that it's going to be the level of customer service you're able to have, whether your customer is the person in the next cubicle, your boss, or actually an outward facing customer of the company, that level of work that you provide, your ability to keep up, right? Your ability to show that you're in the game, that you're helping out. I think those are important. Not always for the win, by the way. There's still a lot of companies that are just going to headcount cut. And I know my friend Sandy, who's with us on Facebook today, has been through some of those before, and that can be ugly, especially if you're somebody that feels like you gave your heart and soul to it, but you're not really giving your heart and soul to the company. You're giving your heart and soul to you, because who wants to show up at a job and just suck? And who wants to be the clog, right? From other people not getting what they want. Don't be a clog. Be somebody who's helping other people get ahead because you're there. So I don't know what we do about it when it comes to not enough jobs. We certainly have had lots of people on Stacking Benjamins talking about how it's more competitive, But as the workplace gets more competitive, you've got to show up ready, which of course is why you watch Money in the Morning, right? That's exactly why. And Daryl says, longer he lives, longer he has to save, so he'll save tomorrow, right? Who cares about compounding interest, Daryl? I love Daryl's sense of humor. Fun stuff there. All right. Those are our two headlines for today, guys. In just a second, we're going to have the big idea, which we do every day here on Money in the Morning, where I take these two headlines, we'll put them in together to a single big idea for you to go and meet your day with. That's coming up in just a second. But first, have to give a shout out to my friends who use Tiller right now. You already know, if you're like mom, that Tiller is the number one place for customizable spreadsheets. So if you're a big enough money nerd that little app on your phone is laughable and you need more than that to track your expenses, get your budget in order, and go where you want to go, well, guess what? Good news. Where in the past you had to completely create it yourself, Tiller has pre-designed spreadsheets where you can just plug and play and still manipulate. You can still change it. So as an example, they have a Stacking Benjamin spreadsheet, which goes over the things that I worked with when I was a financial planner with people. So if you find that to be something that is interesting to you, you head to stackingbenjamins.com/Tiller to tell them that we sent you. You will soon find not just the Stacking Benjamin spreadsheet template, but lots of other templates that power users have used, other people doing what Stacking Benjamins does have made, or you can just make your own. Cool thing is, you download all of your data, whether it's your investments, your budget, whatever it might be. Tiller's incredibly flexible. That's why mom is a money nerd uses it. stackingbenjamins.com/Tiller. All right, let's put these two together, shall we? This is the high wire portion of the show in front of our live studio audience on Facebook. So nervous. The first headline was about healthcare and about healthcare costs. And the takeaway might be an HSA, unless you're Chloe, who has the world's most expensive HSA, apparently. And on the other side, retirement age workers still working, transition to jobs you love, sticking in jobs where you can have a passion about it and you can be in the trench, like literally, figuratively. You are, I'm listening to this great book, this fantastic book, Rise and Grind. Love that idea, by Damon Johns. Rise and Grind. Listen to that right now. Fantastic stuff. So find a job that you can rise and grind at, right? One that you can carry on, and you're not working because it's what you love to do. I think that's the type of job. It's got to pay the bills first, but you got to be able to get passionate about it. So those two ideas. And I think the biggest idea is this. We look at people not saving enough for retirement. That's our second headline today. And then we go to our first headline today, which was all about healthcare being a huge expense. And they say, don't sweat the small stuff. Part of me agrees with that. Part of me doesn't. But if you flip that on its head, don't sweat the small stuff means sweat the big stuff, right? And the big stuff when it comes to your budget are three things, in my view. Number one, biggest expense of all is where you're going to live, because your housing expense is a huge expense. And if you mess up that one, you're going to end up costing yourself a lot of money by having too much house, maybe spending too much to live. That's an important one. That's number one. Number two is your healthcare. So make a great decision around your healthcare so that you're able to save more money, right? You gotta, and to Chloe's point here in our Facebook chat window, people with us live here today, it's going to be different for everybody. So to some degree, you can't be great at everything, but if you're great at understanding buying and selling houses or renting, right? You're great at figuring out a strategy there. You're great at figuring out your healthcare. And third, you're great at figuring out your transportation. Those three things can allow you to save enough money that you can have financial independence earlier. Don't have to be great at everything. But if you're great at those three things, I think it goes a long way. See, too many people clipping coupons, not enough people great at healthcare, transportation, and housing. Get great at those. I think you can quit clipping coupons tomorrow. That's going to do it for today, guys. Thanks for hanging out, everybody, on Facebook. Nice job. Good work today. And thanks to you for listening. We'll see you next time back here at Money in the Morning. Go stack some Benjamins.
Money in the the Morning is created by Joe Saul-Sehy and is brought to our channels by our producer and engineer, Richie Rutter-Reese. Stacking Benjamins and Money in the Morning are for entertainment purposes. Before making moves, consult with your financial advisor. Looking for training sessions? Kathleen Selmans has a great suite of Stacking Benjamins tools, so head on over to learn.stackingbenjamins.com. Hoping to chat with us on the web? Say hello to Shannon Cowan, our social media guru and community manager in our Facebook group. She can be found at stackingbenjamins.com/basement. From the basement, I'm Joe's mom's neighbor, Doug. See you tomorrow.
And it's a wrap. Nice job. Thanks, everybody, for the comments and for helping out with today's show. In the past, I've had these less interactive, and we've had our SB Live be more interactive, and just some of the things that we've been thinking about lately. I like making this show, even though it's an audio podcast, more interactive with whoever's showing up. And I think to do that, I'm going to have to begin. I'd like being able to record just whenever we get it in, like today. But I think I'm going to have to start scheduling it so people know when they can catch us, because I think that's going to make it easier to make it interactive every time. And I want to more often do, because I like explaining how some of these things work. I think also we're going to be doing more headlines that people suggest. So those are the things there. Oh, perfect, Chloe. I didn't know you're Pacific. I never knew where you lived, but just in my head, people live different places. For some reason, I thought of Chloe and I thought East Coast. No idea why. Yeah. And I think we need more people, Daryl, to just have it be interactive like this. And maybe, to Chloe's point, maybe we do one each week. Oh, you were East Coast. That's why. I have no idea why I thought you lived on the East Coast. I promise I don't spend all day following Chloe around. But Lori, and I would love to schedule it. The problem is we have so many different priorities here of stuff going on. It's just committing to do it, right? It's like anything. Commit to do it and it'll get done. So, and Kimberly jumps on that. Thanks, Kimberly, for jumping on too. I appreciate it. And so, people could turn on the notification and find out that I don't know how you turn on the notification to find out that you're live. Mine just pops on. Does yours just pop on? Mine just pops on and says, "Hey, so-and-so's live now." And then I click it and, I'm in it watching. So I don't know. But anyway, that's kind of where my head is. More interactive, hopefully a schedule coming in the future, and taking ideas for these headlines. Because if you see a headline that you like, I know we've had some of them. We took this one from Doug, who put it in the in the basement for people to talk about. So I'll take stuff from the basement, but I'll also take other headlines that people want to talk about. Obviously, we'll still curate. I'm not going to talk about politics. I'm not going to get into heavy duty economics. It just, because heavy duty economics ends up being politics anyway, right? So I'm not going to do that. But if we can make it more interactive here, I think that'll be our next step. I think step one for me was just getting comfortable with doing these videos. And the more I get comfortable, the more I think, you know what, taking stuff that people care about today is going to be even a little bit more fun. So yeah, reading Chloe's thing. Yeah, it's funny because it's really different, Chloe, the different times that people have. I mean, I'll have times that we'll do 9 a.m. Central and we'll have 20 people watching live, which for this is a lot of people because I'm just popping up for, SB Live for our Thursday. That's at the same time every week. That thing, I mean, we've had 65 people, but that is scheduled. To everybody's point, it's scheduled, and it's the and you know what the topic is going to be, and so we'll have a bigger crowd depending on what the topic is. Last week we had, I think sometimes we hit close to 40. I think we got to 38, 39, and when we talked real estate, once we got into the 60s, and OG and I once I think got into the 50s when he came on as a guest on that piece. So. Yeah, and the reason, Kimberly, you don't get it for Money in the Morning is because we just do it. I mean, it is, hey, we've got 15 minutes. Like right now, I'm supposed to have a carpet cleaning guy coming any minute, and he hadn't come yet. So I told Richie, who's out in the other room, just delay him and we'll get this done. And on that note, by the way, I got to see if he's here because he was supposed to be here half an hour ago. So that's what we're planning. Hopefully that's what you'll see in the future. By the way, I say this stuff, and I should say that's kind of my current thinking. We have no official plan to change anything yet, but it's pretty, but I like the sound of that. And it usually takes us longer to change than people hope. Like it's not going to change tomorrow. But I'd say in the next week or two, I'd like to have let's put it this way, in 2 weeks, I'd be surprised if we don't have at least half of them scheduled. You know, I think there's some days during the week that I can schedule. I can probably schedule the Monday. Sure. And I want to schedule the Friday because I don't like stuff getting out of hand on Friday. I like tying loose ends. So if we'll do that early on a Friday, but like Wednesday today, I've already done 5 recordings today and 2 meetings, 1 meeting with 2 meetings with possible sponsors of the show. So Wednesday's always busy. So maybe we start off with half and half. So thanks, Chloe. Yeah, that's cool, Lori. You know, I like the timing of the Thursday thing, and I like them being different. I like that being an Ask Me Anything, just kind of a time for us to hang out. So that's more fun. Although tomorrow's with Tiller, tomorrow's going to be awesome. Tomorrow with Tiller is going to be great. Peter is really has a cool product with Tiller, which is why we talk about it all the time. But he's going to go over. I invited him because they're on Spreadsheet 2.0, and he's going to go over how that works. But I told him I don't want to just do that. I want to talk about budgets. So we're going to show off his new thing, but we're also going to talk about how to budget, how to track, even if you're not using Tiller. So if you're using Spreadsheets at all there. All right. I'm going to go see if the carpet cleaner guy's here. That's the reality of what really happens here in the basement. Making magic, cleaning carpets. I'll see you later.